Our arm has only one bone, and this bone is the humerus. To go over all the different details we find in the humerus bone, I will be using the pictures I'm giving you in the lab terminology list, so you guys can start getting used to all that you need to know for lab and lecture as well. These pictures are showing you the left humerus. This is specifically the anterior aspect of the left humerus, and right here we have the posterior aspect of the left humerus. How do I know this is the posterior view? Because I see in the distal aspect of the humerus this big indentation, which is the part that will receive a specific bone feature of the ulna that we'll be talking soon. So I always know that this big indentation is in the posterior aspect of the humerus. Consequently, I know that this is the posterior aspect of the humerus. Now, when we look at the humerus bone, we can see in the proximal end the head of the humerus. And the head of the humerus is what we articulate with the scapula, which is one of the two bones forming the pectoral girdle. The pectoral girdle, remember, is a group of bones that will be connecting the upper limb to the axial skeleton. So the head of the humerus is what will be articulating with the glenoid fossa of the scapula specifically. And when this articulation happens, we call that the glenohumeral joint. Now, underneath the head of the humerus, obviously we have a neck. So right here we have the anatomical neck and the anatomical neck. What happens is that the humerus bone has two necks. We have the anatomical neck, which is right underneath the head of the humerus. And we also have another neck right here, which is called surgical neck. And this neck is called surgical because this is the place where usually people fracture the humerus bone. And people end up having surgery. So we have the anatomical neck and then we have the surgical neck. Also in this proximal part of the humerus, we see two bumps. And these bumps are right here and right here. We can see them very well in the anterior view, but in the posterior view, we just see the big bump. These bumps are points of attachment for muscles. And we have the big bump and the smaller bump. Consequently, they were named the greater tubercle and this one the lesser tubercle. When we look in the posterior view, we can only see the greater tubercle facing laterally. The greater tubercle is always lateral and the lesser tubercle is always anterior, as you can see right here. We can only see it in the anterior aspect of the humerus. If you pay attention, you can see that we have a groove here. And this groove is between the greater tubercle and the lesser tubercle. How do you think we call a groove between two tubercles? We call it intertubercular groove. Inter means between. Now, through this groove, we have a tendon of the biceps brachii muscle passing. And the biceps brachii is a muscle found in the anterior aspect of our arm. And since we have a tendon of the biceps brachii passing between the two tubercles right here, and we know that the biceps brachii is a muscle in the anterior aspect of our arm, we can remember that the lesser tubercle needs to be facing anteriorly. So the tendon of the biceps brachii muscle can pass between the two tubercles. And since passing through this groove, we have a tendon of the biceps brachii muscle. This groove, besides being called intertubercular groove, is also called bicipital groove, making a reference to the biceps brachii muscle. When we go over the different muscles we have in our body, you guys will learn that we have in our shoulder a muscle called deltoid muscle. And this muscle is like this and attached on the lateral aspect of the humerus bone. And this point of attachment for the deltoid muscle is a rough spot right here in the shaft of the humerus. And a rough spot is called tuberosity. Since this tuberosity serves as an attachment point for the deltoid muscle, this is specifically called deltoid tuberosity. Now I would like you to observe how these structures that we named greater tubercle, lesser tubercle, and head look like. Can you notice that the head of the humerus has a smooth appearance? Is rounded? Of course, this will be used in an articulation. It will form specifically the glenohumeral joint. Now, when we look at the greater tubercle, the lesser tubercle, we see that they are not smooth, they are rough. And that is because they are not articulating with another bone. They are there to serve as point of attachment for muscles. When we look in the distal aspect of the humerus bone, can you notice that this part of the humerus is very smooth? And this smooth part, as well as this smooth part in the posterior aspect, will serve as areas of the humerus bone that will be articulating with another bone. We know that in the forearm we have two bones. We have the radius bone and we have the ulna bone. The radius bone is always lateral. The ulna bone is always medial. How do I remember that the radius bone is always lateral? I remember that the thumb is the antenna for the radial. Remember old days? We had the radial and the radial had an antenna. So the antenna for the radius bone is your thumb. Consequently, the radius bone is always lateral. Remember the anatomical position, the palms of your hands are facing anteriorly, which puts your thumb in the lateral aspect of your body. So we know that the radius bone is lateral. We know that the head of the humerus needs to be facing medially because it will articulate with the scapula. Consequently, if this is medial, the head is medial, all these aspects of the humerus is medial and all this aspect of the humerus is lateral. As a consequence, this part is closer to the medial aspect of the humerus and this part is closer to the lateral aspect of the humerus. Now we know that in our forearm, the bone located laterally is the radius bone because we have the thumb right there. So this specific part of the humerus bone will be articulating with the radius bone. And this specific part of the humerus bone will be articulating with the ulna bone. You need to know the name of these condyles. Remember, condyles are smooth, rounded surfaces. And the smooth, rounded surface of the humerus bone that articulates with the radius bone is called capitulum. And the smooth, rounded surface of the humerus bone that articulates with the ulna bone is called trochlea. How do I remember that the radius articulates with the capitulum of the humerus bone? Is by remembering that for the radial to work, it needs to capture the signal to tune in. So I remember that the radius bone articulates with the capitulum of the humerus bone. And by exclusion, the ulna bone will articulate with the trochlea of the humerus bone. Now, as I mentioned, the trochlea as well as the capitulum are smooth, rounded surfaces used in articulation, and as such, they are condyles. They are the condyles of the humerus that have special names, the capitulum and the trochlea, but they are condyles. Now, I'd like you to notice that right here, we have a bump to the side, and we have a bump to the side. Now, these bumps to the side, they are above the condyles right here. And as such, they are called epicondyles. Now we have the epicondyle on the lateral aspect. This is the lateral epicondyle of the humerus. And we have the epicondyle in the medial aspect. So this is the medial epicondyle of the humerus. Now I would like you to go and stay in anatomical position. And then with one of your hands, you touch your elbow. And then you go medially. Do you feel a bump? Guys, that bump that you're feeling is the medial epicondyle of the humerus. Now try to go and touch the lateral epicondyle of the humerus. Can you notice that the medial epicondyle is much bigger than the lateral epicondyle? And you can feel that in your upper limb. So it's very easy to remember that the medial epicondyle is much more pronounced than the lateral epicondyle. And obviously the medial epicondyle, since it is facing medially, it will be always in the same side as the head of the humerus. Now, in case you only have an image of the distal aspect of the humerus, it will be very easy for you to identify which side of the humerus is lateral or medial. Because when we are looking at the humerus, the big epicondyle is always facing medially. And we can feel it in our upper limb. And the lateral epicondyle, which is small, is always facing laterally. Now, when I'm looking at the humerus bone and I see this depression, I know I'm looking at the posterior aspect of the humerus bone. And do you remember how do we call a depression? It is called a fossa. Now, this fossa of the humerus articulates with the olecranon process of the ulna. And that's why this fossa receives the name of olecranon fossa. Now, if I can identify the olecranon fossa and I can identify the medial epicondyle, I can say if that humerus that I'm looking at is the right or left humerus.